Test closed captioning, 1, 2, 3. Test 1, 2, 3. Hi, good afternoon, everyone. I'm Dawn Jeffries, and I will be moderating today's conversation with President Tim Sands. And before we begin, I'd just like to let you know that I am in my own home, in my own pod, so to speak. And so I will take off my mask and let you know that all of our guests are in their own personal spaces as well. So I invite you to remove your mask as well. I apologize for the delay. Technology sometimes, as you all know, I'm sure, gives us a little bit of a headache, but we get through it and we move on. As I've mentioned in previous seminars or webinars about wearing our masks, this is really our default. And we really just do it to encourage you to always mask on and have that be your default as well. Again, thank you for all of you for joining us, both to our panelists, who I will introduce in just a second, and to those of you who are watching. As always, we are recording this session, so it will be available for you to view after we wrap up today. Joining us today is President Tim Sands, Vice President of Student Affairs Frank Shushock, Assistant Vice President for Emergency Management Mike Mulhare, Dean of the Graduate School Karen DePaul, and Executive Director of the Fralin Biomedical Research Institute, Dr. Mike Friedlander. The students joining us today include Camelia Pastore, undergraduate student representative to the Board of Visitors, Sabrina Sturgeon, graduate student representative to the Board of Visitors, Adil Sagir, undergraduate student government president, Maruf Hawk, who is the graduate student assembly president, Janae Sebrin, a second-year graduate student, a 2018 Virginia Tech alumni, and the first African-American nanoscientist, which is awesome to say. Also joining us, Margaret Nagai, who is an Institute for Critical Technology and Applied Science doctoral scholar. That was my dog, sorry. Augustine Fiorito, a junior in chemical engineering, and Chapman Pendry, Vice President of Student Government. So for the next hour, our student panelists will drive this conversation. They will ask the questions that they have and questions that they've brought to the table for us from their peers, all as they relate to COVID and to the return to campus for this fall semester. So without any further wait, let's get right to it. And Maruf, why don't you start us off this afternoon?
Hello, good afternoon, everyone. I'd like to take a quick moment to thank President Sands and all the other administrators for hosting this town hall for us. And additionally, I'd like to thank the entire student body for forwarding questions to us in various formats. And without further ado, I'll begin. The COVID dashboard is an improvement, in my opinion, from the prior version in terms of reporting daily tests and cases done. However, it's evident that we've drastically reduced the number of tests completed to Virginia Tech students, seem to be factoring in days where testing is not done into the 7-day moving average, are not reporting the number of quarantine space used, not reporting location data in terms of positive COVID cases, not reporting the overall positivity rate, but are reporting the low positive number from move-in, making it look like the summary data at the very end. I think we all know that UNC and Purdue have both pivoted online when they both reached 150 positive cases, while we're at 633 with 134 students in isolation. To everyone on the call, what is the metric that we're looking at that will indicate when or if we pivot to 100% online? And universities are bringing out spring semester plans. What are our plans for spring semester?
Well, thank you, Maruf. Maybe I could start with that and then ask our panelists to augment. I think I caught most of those questions around the metrics. We did some work back in the summer and published a plan that went through the State Council on Higher Education for Virginia, SCHEV, that included our contingency plan and included the metrics that we're tracking in order to inform decisions. None of them are hard triggers. In other words, we don't have a numerical number that all of a sudden causes us to move in a different direction, but they all will incite conversation. They'll bring our leadership team together and others to, and our partners in the Virginia Department of Health to to look at the situation carefully and decide whether we need to make a change. The metrics are varied. One of them, of course, or one set is the hospital capacity and the healthcare capacity in the region, including Roanoke. So we watch that carefully. We have Mike Mulhare on the call here, has frequent conversations, as do I, with the healthcare leaders in the region. Are they seeing any hospitalizations related to Virginia Tech? Are they seeing any, do they have any concerns with capacity in ICUs or hospitals in general? And we get a feedback from them just almost on a daily basis. And certainly if we have a question, we reach out. And so that is probably one of the most important metrics we look at. The other is quarantine and isolation space. And we reached a point, as you know, a few days ago where we felt like we needed to add some quarantine space, and we had an opportunity to do so, or isolation space. That's, that we recognize that that's not ideal for those who were displaced. They got a financial benefit from it, but it was a hassle. And we thank them for being so cooperative with that. We were able to free up another 40 rooms. And so that's in East Eggleston. We haven't used those, nor have we used the other capacity we have outside of Newhall West. So we're still using Newhall West, and we'll use it until we feel like we have to move into another space. But that's an example of the kind of conversations that occur when we hit about 50% of our capacity. We say, okay, we need to think about either adding more space or taking a different track. And since we had space available, we went that route. We certainly are monitoring cases, but as you know, cases are quite misleading. Not that the number is an overestimate, it's an underestimate more than likely, but that isn't the only thing that we're watching. We're watching the pace of increase. We're watching positivity rates. We're doing a whole host of testing, and you'll see the testing ramp up markedly over the next several days. One of the reasons that it ramped down is that we had a entry testing process that you're familiar with. We went through and tested about 9,000 students in a matter of several days. And then we shut that site down, and we're putting up a new one. In the meantime, Schiffer and ArcPoint have been doing tests, and we've been doing several kinds of tests. So I'm just touching on some high level issues, and we'll let others fill in. But we're looking at surveillance. We're monitoring the wastewater. We're also looking at random samples. We're looking at high contact students and staff, and they've been defined and notified, and we're working our way through that list, and we'll keep cycling through it. And of course, first priority is to look at symptomatic cases and those who have been identified by the Virginia Department of Health as contacts. So that will always be our priority, but we're doing all of those kinds of tests, and they're ramping back up again, and others can add to that. We're tracking it. We're working closely with the Virginia Department of Health. I say one of our most important collaborations is with Noelle Bissell and her team in the New River Health District, and we have similar collaborations around the state where Virginia Tech has facilities. So we really rely on them. They have the sole responsibility for contact tracing, and we can augment that with case management, which we do, but it's really up to them to monitor contact tracing. Primarily, it's not just their job. They want to protect people's privacy, and so part of the reason that we have that partnership is because of that privacy protection. And we listen to them. If they say they're seeing spread, that's where we would have a concern. So if we see beyond what we have already, if we see spread into populations that are not Virginia Tech populations or not under control, then that would cause a conversation about what to do next. My last point, now before I turn it over to others who might want to add some dimensions to my answers. The last point about going online, to be perfectly honest, there isn't a lot of benefit in that. It depends on the situation. That's one approach to it. But if you may recall, we only have 7% in person right now. We have 30% hybrid, and that's more or less the same graduate and undergraduate. So going online is not the end all. It might be a small step, and it's certainly one of the options we have ahead of us, but probably not the most effective thing we could do. Our most effective thing is the public health messaging, to continue to work hard to make sure that people wear masks and that we avoid indoor gatherings, especially. with people that are not in your pod or not in your family. And then the testing ramp up, I think will put us in an even better position in the future. And I'll invite any others on the panel to maybe correct or fill in gaps that I left. And then maybe we can have a conversation about some of the points that I maybe didn't hit as well as you'd like, Maruf. But thank you for the questions.
I'll just comment on the dashboard a little bit. You mentioned the positivity rate is something that's not shown. The positivity rate, if you've watched it on the VDH dashboards, is a number that's extremely dependent on the number of samples you've tested, and you can alter that number significantly. If you looked when we were at the VDH numbers when we were doing move-in, because of all the sampling we were doing, the positivity rate for the New River Valley decreased substantially to about 1%. But that was just a function of the number of testing. And so that number, again, can be a bit artificial depending on what's happening and how you're, what's happening in the health district. And that's why we really look at that 7-day moving average of positives. That's important because that's telling us the trends of what's happening based on the testing we're doing in Schiffer. That really informs us much better on actions we need to do or actions we need to consider. I think the one metric that Dr. Sands might not have touched on, and I think it's one of the more important ones, is the capacity to provide services. And that's one we look at very closely. We can typically usually find more space, but do we have the resources in place to provide the services needed for those who might be in isolation? So that's one of the key metrics that we do key on and we pay very close attention to.
I'm going to interrupt because my questions are somewhat related to Maruf's when it comes to testing. And I just want to preface my questions with a simple but very important statement that a failure to control COVID-19 at Virginia Tech is a failure to the entire Blacksburg community and surrounding area, and thereby defies the very principles of ut prosum if we don't do a good job. And to my disappointment at Virginia Tech, off-campus students were not required to get tested. And alarmingly, I don't know if you are aware, but some Virginia Tech students are purposely getting tested off campus to avoid campus mandated quarantine and to avoid raising those Virginia Tech numbers. In addition, the research shows that people who are actually more contagious in the 48 hours prior to showing symptoms, which is the pre-symptomatic stage, and even asymptomatic carriers are shown to be really important in disease spread, potentially unknowingly exposing people for up to 14 days. So because of what we know about that, but with the pre-symptomatic and asymptomatic spreaders, and knowing that students are avoiding campus testing to avoid the quarantine, why haven't we implemented random or required testing? And why are we not focusing also on asymptomatic students?
Well, thank you, Margaret. Those are great questions, and along the lines of the same thinking that we're doing. We are doing random sampling, and that will scale up. And we're having a conversation, matter of fact, this afternoon about what it means to require it. But I think you're absolutely right. The reason for the random sampling that I think is most important is that it is the only way that we can get a true positivity rate that tells us within statistical limits what is actually going on. And in order for that to happen, we need excellent compliance, or it needs to be required. So we're having that conversation right now, but we are doing it right now, and we will continue doing it because I think as the pandemic moves along, this is probably the metric that is most helpful and most important. We're also doing the wastewater testing, so that is ramping up. We're getting baselines on that, and that Sentinel approach will help us identify where we might have an outbreak. I'd like to ask Mike Friedlander to maybe make a couple of comments about testing, and we could spin off that if there's more interest in going in depth.
Sure, be glad to, Tim. Thank you. And thank you, Margaret. Good questions. So yeah, sometimes I find there's a bit of confusion about the terminology. So if I could, just for a second, maybe just step back. So we talk about testing, we talk about doing runs in the lab or collecting samples, and they're different components. So the first thing you would encounter as a patient or student is to have a sample collected. So you may go to Schiffer, for example, if you're symptomatic. You may go through the ARC point collection at the stadium. and somebody there will take a sample. So that's the sample collection. Then those samples are delivered to the lab for analysis, what we call runs in the lab. And then after they're analyzed and we get the report on whether there's a positive or a negative, or in some small number of cases, what's called an indeterminate, those are reported into a database. And that database, when there are positives, of course, goes to the state health department as well as Schiffered. And that happens virtually right away. When I say right away, just from a time point of view, let me explain. The sample may be collected in the morning, for example, in Blacksburg, and then would be delivered here by, say, noon or 1 o'clock to the labs in Roanoke, and then be analyzed by, in most cases, that night and posted to the database. Sometimes the samples that are collected later in the afternoon in Blacksburg won't get here till later that day or the evening, and then we'll do the runs overnight and have the response and the data the next day. Now, the runs we do, the number of runs we do in the lab and the samples that are tested is limited by the capacity of the lab. And we could talk about the technical details of that, I'd be glad to, but basically there's a certain number of machines, people, and then there's time to take each one of the samples and do the various things you have to do to extract RNA and so forth and so on. And so we got as high as about 1,250 samples that we ran in a day, particularly during that move-in period where all the students were coming to on-campus housing, and that was really pushing us to our limit, but we did it. We're comfortable running between 800 and 1,000 runs each day right now. And the good news is, in terms of numbers and getting to the point that President Sands addressed as well, as we want to spread out and do more of this sort of random or surveillance testing, let's say, one of the things we recently just got approved for was to do what's called pooled sample testing. So you can actually take more than one sample together and mix them together and run them together in a batch. It turns out there's a lot of science behind how many, and the magic number is 4. That is, we can do 4 together or pull them together. And if they're all negative, it just comes up negative. And that way you didn't have to run 4 separate runs. You only had to run 1 run. Anytime it comes up positive, of course, we now have to go back and test each one of those individually. But having said that, we can fairly easily get up to, say, 1,500 samples that we can do in a day by a certain amount of pooling for surveillance. We don't want to do the pooling for the students that come in asymptomatic, that is, to Schiffered. We want to test those individually right from the get-go because there's a high level of suspicion, that they would be positive. But anyway, that's a little bit of the background, maybe too much, I apologize. But I just want to explain a little bit about the numbers and the capacity. And the last thing I'll say on the subject is, of course, we're focused on Virginia Tech, but President Sands alluded to this partnership. We're working with the health department. We work very closely with them. And we're also helping them to test other people in the community as well, particularly when there are outbreaks. So we're balancing those numbers.
Yeah, and I could say to the point of that you made, Margaret, about, and I think others have made this, that students are going outside and getting tested. We're trying to encourage self-reporting. We understand that sometimes students will go outside and be tested, and we may not know what is going on with them. We do have a way of getting that information eventually, but it slows down the process. So I would definitely encourage all students to first check with Schiffered, and as ArcPoint scales up again, I think we'll be able to handle pretty much any test that makes sense. It's all risk-based, but we think we can do it. You can look, and this is where we get into the dashboard issue that Maruf raised, because we're in partnership in the New River Valley between our Schiffered Health Center and all the testing that it does, and the other clinics and private testing labs around the region. We have a division of data, essentially. So the New River Health District and the health districts around collect data. And so you can go on, and as I think most of the people on this call know this, but you can go on the Virginia Department of Health site and see how many cases they're registering for Blacksburg or for Montgomery County or for Southwest. And you can then, and also New River Health District. So it's cut up a bunch of different ways. And if you kind of subtract out what we're seeing through Schiffered, because our Schiffered data does go and is rolled up into that, you can kind of get a sense for the percentage of our population that is likely going outside for tests. And it's been a minority. It's not zero, but we are concerned about that, because if someone's tested at Schiffered, first of all, it's free, and we have control of that data, and we can really use it in an actionable way. If people are being tested off campus, students especially, then it takes longer for us to get the data we need to do the case management. So what I would encourage students, even if you do get tested offsite, if you are positive, report it to Shiffers so that we can then deal with the case management. We can support that student in isolation or quarantine, whatever the situation may be. There is no retroactive. I know there was early on some concern about student conduct, that we would use positive data to somehow penalize students who were coming in positive. And we don't do that. There's not enough. That's not a very effective use of resources. We do have student conduct to address continuing behaviors on campus and in the community, but we're not going to go track a positive case back and then use it to subject that person to student conduct. So I'd just like to get that word out, because the more data we have, the more data we control, the faster we can react, the better we can distribute resources.
So I'm going to jump in one more time because we have a lot of questions to get through. But to Dr. Friedlander's point, if our testing capacity is that high, it's disappointing that according to the dashboard, we've only been doing a few hundred tests every day. And going back to the dashboard, there have been a lot of complaints about the dashboard, saying that it is actually raising more questions than it answers. Excuse me. So I guess I won't phrase it as a question, but more as a statement, since we have so many to get through. But it would be nice if we could see increased transparency about where these cases are coming from. Are they on campus? Are they off campus? What dorms are they coming from? What campus is it? Are they all on Blacksburg campus? And it would be nice to know if we can include hospitalization data on there as well. So with that, I'll pass it to whoever's asking the next question.
If I could react to that quickly, Margaret, because I wanted to be clear, emphasize something that Mike mentioned. We're doing testing for the health districts in the western part of Virginia. In fact, in terms of pro-sim, that's something that we're doing for the community. And so there's always a negotiation. What's the highest priority set of tests that need to be done? If there's an outbreak in a long-term care facility, and it's urgent, we're going to jump and do that first, unless we have an outbreak that we're dealing with. So that's a daily negotiation with the health districts in the region, stretching from Roanoke, Allegheny westward. And Mike and his team are constantly in that dialogue. So if you see that we've done 300 tests in a given day, it doesn't mean that only 300 tests have been done. It means that 300 have been done for Virginia Tech. The rest are likely being done for the community because of an urgent need. So that is a constant dialogue. But as far as the dashboard goes, we'll look forward to any input you have, and we'll keep, as you know, we keep iterating it, so we'll keep improving it. The only limits we have is data that we control and data that others control. So the reason we put those links there is there's a lot of risk in us taking data off a site when we don't control the data and then representing it as their data. So that's why we give the link. But where there is transparency that we can add without violating FERPA or without violating people's privacy, we'll keep looking to add that.
And President Sands, I just might add to Margaret's question is the reality that we're about to really amp up our testing capacity beginning on Monday. So beginning on Monday, we're going to begin testing 7 days a week, and you'll be seeing over 600 tests a day.
And if I could just add to Margaret's question, yeah, good follow-up point. So President Sands made the point, we've got the data for the number of tests we're doing for the health department, plus you're just seeing the Virginia Tech tests. We're up at 800, 900, we're running near max every day. And the other thing I wanted to add, and this is from Maruf, a point he brought up earlier, we've been working on a dashboard just for a separate campus here, the Health Science Campus in Roanoke. And I think we're about ready to launch it this afternoon. Maruf, just want you to know that particularly for the graduate students located in Roanoke.
Awesome. I just wanted to I know we have a lot of great information, but we also have a lot of questions. So I want to try and pivot this to talking about a different type of conversation. So in some of the experiences I've had this past week, I was speaking with one constituent about how safe they were being about COVID. And they told me they were being very safe. And I asked them, about how many people had you been seeing? They said about 300 people. And so I asked them, a little bit more, and they said, and I quote, "I've served my time." They said, "I've served my time. I'm going to get it anyway. Might as well get it while I quote rage." So that was one experience I had. And then talking to another student on campus, they were working in Squires into the evening, and they started to see students from on campus going downtown, and groups not wearing masks. And then they said as they saw them coming back, they recognized some of the same students coming back with different large groups of people. So we see that there are students who aren't following the guidelines and really embracing what Virginia Tech is trying to do. So what happens to students who break the COVID rules and are reported to the Dean of Students and to student conduct? I know and I believe most of the community hasn't heard anything about any sort of suspensions after the original 7 students from the first weekend. And we're just curious what's going on.
So Chapman, first of all, thank you for your candor and for your question and comment. I want to say that every community out there is dependent upon people in the community having a commitment to the whole, and that no matter what is going to require some level of sacrifice, whether it's being in quarantine or isolation or making choices, social choices, how you gather, wearing a mask, keeping your distance, washing your hands. These are differences in the way that we have typically operated. And being committed to that is hard. And I just want to acknowledge it's especially hard to be a college student right now. I would not want to have to be in your situation. I don't want to be in the situation that I'm in. So first, I want to say to those of you who are doing everything you can to promote public health, to make sacrifices, thank you, thank you, thank you times 10. It's making a difference. And I would also like to say that I think 95% of Virginia Tech students are doing it really well. The 5% of students that aren't is problematic. And it's not just college students, it's every community. Those who choose not to follow public health guidelines are prolonging the pain that we're in. So we need people to step up and to make the sacrifices now for the whole and to shorten the pandemic. So that's why we have held some students accountable. But the bottom line is we're not going to be able to hold every student accountable. We need people to make good choices out there day in and day out. But we have made over 40 interim suspensions at Virginia Tech for people who have not followed public health guidelines. We've removed housing for an equal number of students in those situations. And we're having serious conversations with students who aren't making good choices. But in all of that, I want to just implore you to keep making good decisions and keep holding people accountable, having conversations with people so that they do make good choices. If you, we talked a lot about testing. I just want to point out there's a great New York Times article yesterday about the University of Illinois. They're doing the most robust testing, every student being tested twice a week. But they had students who chose to go to social events and large social gatherings after they even tested positive. So there's lots of ways that we make choices that are for the whole, and I think that's got to be critical. And I appreciate you caring enough to articulate it the way you did.
Do we have another question?
Maybe I could just follow up on what Frank said. He said it so well. I've had students either indirectly or directly tell me that they want to get it because they think that they'll be done with it, as you put it, Chapman. But I mean, if you look at the science, that's a really risky thing to say, because we've only been into this several months. We don't really know how long immunity lasts or how effective it is. We don't know when we're going to get a vaccine. And we don't know if it'll be effective. If people don't take it, it won't be effective by definition. So one of the planning guidelines that we're using is that we're in this for the long haul. This is not a fall semester scenario. This is at least a year. That's not to say that, if things go well for us over the next several weeks and months, that we can't start to get back to a more normal way of living, but to assume that it's going to be over quickly, that if you get it, you're done, is just a very risky and I think incorrect assumption at this stage, given what we know.
President Sands, could I add something to that? This is Mike. One of the unknowns that we're dealing with, we're seeing more and more data on it, is really the pathogenesis and trajectory of this disease. So I hear some of the same comments, Chapman, that you relayed. I've got grown daughters and grandkids, and talk to various people, and I hear people saying that, and I hear people thinking that there's a real protection for people under a certain age, for example. We've heard that since the beginning, and absolutely, statistically, there's a difference between those in, say, the college age and older folks. However, more and more we are learning that even amongst young and healthy folks who get this, there can be long-lasting sequelae, and we're just starting to understand those things. So I don't want to be, cast a wet blanket on things or scare people, but I think, the truth and the reality as we know it and the science and the data are extremely important. So I think it behooves all of us who are mixed in with that and aware of the data to share with people that one is taking a big risk. It's just exposing oneself. The idea, I get it, I get over it, and I move on. It's not likely to be that simple. And we have an obligation to our friends, colleagues, co-workers to make sure they're aware that it's not that simple.
I want to jump in here and continue on this topic of rule enforcement. So students would appreciate the university being more sensitive about recommending us to call the police on each other. Though we want to preserve our community's safety, we're not willing to be the reason that a fellow Hokie gets an arrest on their permanent record, or worse, comes to bodily harm or is killed. So we would love to know some other effective measures to still be able to keep our community safe. And on top of this, for students who do choose to call VTPD or Blacksburg PD, apparently sometimes these police departments have been selectively choosing which calls to answer or just simply not showing up. So when this happens, the burden falls to our resident assistants, who are other students who didn't sign up for being a frontline health worker or law enforcement during this time. What do you think should be done about this?
I can certainly, Camelia, try to tackle that. And first of all, prior to this meeting, I was having another conversation with the police and some concerned students who know that this is not a great time for the police to be out enforcing wearing a mask, for example. In fact, the governor has said that that's not the role that we want the police playing, is enforcing mask wearing and these kinds of things. So I think the first, let me just say the most important thing that you can do is model the way. I think it's so important. And the way that we model the way too is by also educating people about what the reality of public health is, and being passionate about how important that is that people do that. Because the bottom line is, students are going to listen to you in a way that they're not going to listen to any of us right here. And let me just say again, Camelia, you included your social media work, advocating that students get on board with these things. And it's not just students, it's all of us. We've all got to do this. So I think first and foremost is model the way, educate, be passionate about that, and talk to people about why it's important that they follow public health guidelines. If you have to move to an authority figure, whether that is an RA or a professional staff member, then that's step two. And some people are going to feel more comfortable doing that. And I think that's a reasonable thing. I think it's a hard thing for RAs to be. It's a tough time to be an RA right now as well. But the police, that's not the role that we've asked them to do. What we've asked them to do mainly is to respond when people are being non-compliant with staff and professionals on campus who are asking students to comply. I will say that I think most students are complying. There are exceptions, and the exceptions ring loudly. We see them, they're very visible. They're painful to see. But my best advice is just to keep doing the right thing yourself, and I think it'll be making a difference. I also just want to emphasize too, we're in the long haul. I have heard a little bit of the message of we're tired of this, and that's not just students, it's all of us. But we're going to have to be vigilant if we're going to get through this.
Okay, thank you. I'll go next. So when we talk about COVID, really looking at the results of COVID, specifically within the Black community, we realize that they are disproportionately impacted by COVID compared to other populations and groups. And so I just wanted to know, along with other African-American students here on campus, because I got the chance to talk with them just to figure out what they wanted me to ask. But we want to know exactly, how do you all plan to help students with COVID, whether it be health tips, aid, and everything else during the pandemic, especially with knowing that our community is basically under attack right now from all which ways of life right now. I think
That's a great question, Janae. Thank you. I think you raised some issues that we have only started to address locally in terms of disparities and patterns that we're seeing with respect to COVID-19, but we will continue to provide health guidance and support. There's no question about that. That's a high priority. I do worry, sort of addressing Dr. Shushok's point, that there are other forms of support that we need to be providing, and it's not just for the Black community. It's for all of our communities, but especially the Black community, given the environment we're in. And I'm very worried about, if you ask what worries me in terms of the pandemic, it touches on this exhaustion in terms of having to stay with it and stay on top of the public health guidance and making sure that we don't let our guard down, but also the mental health issues around being isolated, especially for students who are just arriving on campus, feeling like they're not yet part of a community. And there is much more work to be done there. So thank you for raising that question. I don't know if maybe Dr. DePaul would like to say a little bit about what you're doing.
Yes, thank you. And again, Janae, good question. Through the grad school, we have Office of Recruitment, Diversity, and Inclusion. And Janae, you know that, of course. And we are, through that office, having some connect lunches, or not lunches face-to-face, but sessions in which we are convening groups to talk about some of the concerns. There are some programs offered in our health and wellness room in the GLC. And I know that Dr. Lee, Sharmita Lee, has put together some care packages. And now we cannot give care packages out to everyone, but she has done some of that, trying to reach the population that may not have finances to get the hand sanitizers and the masks and some general things. So those are, a couple of three things that I would put out there. And other ideas that you have, let me know. I'll get them to her. I know there's an event coming up relatively soon, and I would like to talk more about with you all and how the grad school, how we can reach out.
I would also add, thank you, Dr. DePaul. I think the Office of Inclusion and Diversity is doing some wonderful programming. Of course, it's conclusive VT week, but Dr. Menaprat Clark's Making the Chair Fit and Unfinished Conversations, I try to make every one of those I can, because it's not only good for me to hear what is on people's minds, but also to give everyone a chance to build community in a time where it's really difficult to build community. So to echo what Karen just said, we'd love your ideas. I know some of you have already presented some ideas about building community virtually. And I think we have to keep on that, because that is what's going to get us through this, is really taking advantage of our community. It's one of the things that's the biggest challenge that we face is Virginia Tech is, with respect to the virus, is that Virginia Tech is known for experiential learning, for hands-on learning. It's also known for very strong community, is known for getting thousands of students and community members together in community, doing all sorts of things all year. And that's really what distinguishes Virginia Tech. And yet those are exactly the kinds of environments that are challenging with respect to a communicable disease like SARS-CoV-2 and COVID-19. So we would love to tap into any ideas you have for building community in this challenging environment. That is what will get us through.
Great, thank you. So just shifting gears again a little bit, we're trying to get through a lot of questions. A large question people have is many students, both undergraduate and graduates, depend on Virginia Tech for income, whether it be working campus and dining halls, labs, or different offices, as well as in-person research. What will happen for these students if campus goes remote?
Well, I'll maybe make a couple of comments and then turn it over to some experts we have here. But we went through that. We had a little trial run, whether we liked it or not, and that was in March when we went to remote operation, and we did so rather quickly. Back then, we didn't know much at all about the virus and about the disease that it causes, and we were reacting partly because we had the opportunity being on spring break, and partly out of uncertainty as to what was ahead of us. And so we did go remote, and we were a little more cushioned then because we had only a couple of months left in the semester, and then we were entering summer, which is normally light. But we did find that it was a hardship on quite a few of our students, undergrad and grad, student wage workers, certainly those who are working in laboratories that had to spin down. And we've spun those up again for the most part. There are a few exceptions, but for the most part, we're back close to normal operation. We're even starting to do human subjects research again. It's harder, but we're doing it. And we've managed to keep the dining halls operating and to keep the residence halls operating. But if we were to go back to that mode, it would be a painful shift. There's no question about that. That isn't the only thing that weighs us in the direction of staying the course. Of course, we're absolutely, it's health, public health. It's making sure that the disease doesn't spread to the community, that we're watching that and mitigating as much as we possibly can. But you raise a good issue that our community depends on Virginia Tech to a large extent. And since this is the long haul, we can't make those decisions without weighing in the bigger picture, the more holistic viewpoint that thousands of people, students and our employees depend on Virginia Tech for their livelihood and for the food on their table, so to speak, and their shelter. And so that it's a factor. It's not the only one, but it is a concern.
Let me add relative to the assistantships, the GAs, graduate assistants, the GTAs and the GRAs. When we did the pivot in March, all of the graduate assistants stayed on their assistantship through the spring, and that's what I'm anticipating, that if we have to pivot before Thanksgiving, that we would still continue with our plans to go on to more online virtual after Thanksgiving. The grad students will still be on assistantships. The wage is a different matter. International students are impacted differently, but I think from my commitment to the grad students is that they will continue to be on assistantship through the end of the semester. And just while I'm thinking about it, we have in the grad school already worked on some principles for a pivot post Thanksgiving, or if it were to happen before that. I want us to be prepared and to have some understanding and to share with you all what those principles will be. And we're working on those right now.
Thank you for speaking on that, Dean DePaul and President Sands. The next question that we have is that currently students are going through a lot right now, and that's to put it mildly. And we need support from professors and the administration to get through this semester while taking care of our mental and physical health. It's been reported that currently Dean of Students' office does not support verifying absences for anything COVID-19 related. And in addition, class is one of the few normal parts of Virginia Tech right now, but many students will spend their entire class without engaging with other students or the professors. So the question that we have today is, how can we create a more empathetic academic environment than what we're seeing now?
Thank you, Sabrina. Maybe the first part of that question, perhaps Dr. Shushaw could address.
Sabrina, thank you for your feedback about the Dean of Students Office. I'll have to understand more what our policy is related to absence verification, but that is certainly something we can look at. And I'm grateful that you're talking about empathy, because we can all work really hard on growing our empathy, because it's hard out there for all of us. And it's even harder for others, for certain people. There's the compounding effect of pandemic, racial strife in our country, inequality, loss of jobs. It is tough for so many people out there. And sometimes you can't see it automatically. You don't know what's going on underneath the surface. And so I think it's good counsel for you to ask Virginia Tech to work really hard to be empathetic in all situations, and to understand how policies may not feel empathetic, and see ways that we can adjust them to be more empathetic. So the other thing I just wanted to mention is related to what Janae was talking about as well. I think we all have to do a little more to tell people when we're struggling. And I encourage people who need help, whatever that is, whether that's financial assistance, whether they're struggling finding a job, whether they're struggling with their health care, whatever the issue is to please let us know. And we will do our very, very best to find you the resources to help you get through that hardship. So the Dean of Students Office is the first place to start, and they will make sure that you get to the place that's gonna be able to resource your request as best as they can.
So with that, I'm going to jump in again. I had a student actually email me during this call, and just wanted me to let everyone on this call know that their experience with Shifford was that Shifford is actually encouraging students not to get tested, and the student had to actually fight with a nurse at Shifford to get the test that they wanted. So I just wanted to let that out there. I also wanted to let you know that people are complaining about the lack of contact tracing. The Hokey Ready app is pretty disappointing. It doesn't let you know if you've come into contact with a COVID positive person. It doesn't actually stop you from going on campus if you are displaying those symptoms. And these are just things that people wanted to be expressed.
Margaret, can I respond to a couple of those points? I'm pretty familiar with the operations at Shifford. Actually, my wife's a nurse over there, and because of demand for testing, there is some triage that occurs. And for instance, if you were a student who thought you came in contact with somebody in the last 24 hours and wanted to be tested, the value of that test is extremely limited, if of any use at all. So I suspect what was happening there was they were trying to have a conversation about whether it's actually worthwhile to be tested at that point, or whether you need to wait, or it could be possibly the information you presented did not create a need for a test. And again, when you do a test that's not needed, particularly in the Shifford Health Center where they're working with symptomatic students, you're actually taking an opportunity away from somebody who may need that test. One of the things we will do, and Frank mentioned it, was that starting next week, we will have a lot of additional capacity for testing. So there'll be more opportunity for somebody like that who just wants to be tested to get a test. So I just wanted to, there is some triage in there, because again, there are limited resources, and we want to make sure those resources are used effectively.
And Margaret, I might just talk about one thing that is happening, and it's the reason that people are using tests, that some people are using tests. We have some students who have been tested 5 or 6 times, and they're using tests to live their life in a pre-pandemic mode. And so what we're trying to do is to use our resources very well. And so from a triage standpoint, helping people understand when's the best time to get tested. But at the same time, that's also why we're extending our testing to 7 days a week, and increasing the amount of testing a lot, so that we can do more of that. And I just, because I work closely with the Shifford team, I just want to also say they have worked day and night and care deeply about students. And we're building the infrastructure to do more testing. It's just been a lot of infrastructure building.
If I could, thank you, Frank. If I could maybe touch on the contact tracing issue. This is a unique, well, not unique, but a special issue that we have in our arrangement with the Virginia Department of Health. They are exclusively responsible for contact tracing and have not engaged our request to be part of that. And I understand why. And they make very good arguments for why. But they also have a lot of experience. And so they also do triaging of contacts, and their bar is pretty high based on their experience in terms of what defines a contact. You know, you've probably heard this over and over, that it's at first glance, it's 15 minutes within 6 feet without masks, but it's a lot more subtle than that. Of course, it depends on whether you're indoors, outdoors, what the ventilation's like. You can go down a list, a timing of everything. And so they look at each case and they determine what defines a contact. And sometimes people want to have more people considered as contacts, and that's where we end up with a challenge in terms of testing and managing those cases. But that is a responsibility of Virginia Department of Health. You referred to the app, the Hokie Ready app. The app I think you're thinking about, although you mentioned something that could be in Hokie Ready, but COVID-Wise is the other app that the state of Virginia has introduced for contact tracing. I would classify that as largely an experiment. We certainly encourage you to download it. It's very much privacy protected. It was developed in a time just a few months ago when you had to build an app on top of the Google Apple API in order to make it work, but it does detect if you're within roughly 6 feet for 15 minutes or so of someone else who has downloaded the COVID-Wise app. And it will register a contact and send you a push notification if someone that you've been in contact with, and you won't know who it is, has received an authorization from VDH and a PIN number for their positive test. They enter it, and then that information is pushed out to anybody who is considered a contact based on the software. Of course, that's starting to change. There were some challenges with that methodology because you could spoof it, and that PIN has helped. But now, you know, you've probably been reading about the new Google Apple approach, which doesn't require an application. It's built into your phone. So the reality is that technology is, we encourage you to download it. We encourage you to use it. We are confident in the privacy and security protection that it offers. It's been vetted quite a bit. As to whether it's effective or not, it's certainly not going to work unless almost everybody downloads it, or a large fraction. And even then, I have my questions because it can't tell whether you have a mask on. There's certain things it can't do. It's just not possible. So I think I do download it, use it. You probably won't get a notification on it.
Thank you, President Sands. We have one more question for student life. We have the UVA game coming up in about a week. We're concerned about potentially thousands of people coming into Blacksburg who all of them may not follow COVID guidelines, especially with tailgates. So I just wanted to know more about what the plan looks like for game day.
Well, I'll say a little bit and turn it over to Mike Mulhare, but we've been working throughout this pandemic with the New River Valley partners, including the town of Blacksburg, but even beyond that, Christiansburg, the county, pretty much all the health districts. We're all in this together, the big employers. And we, as you know, announced a couple of weeks ago that we were not going to permit tailgating on campus or in the town of Blacksburg. But how much can you do? I mean, you cannot. We don't live in a state that or a country that will allow restrict movement at the level that would prevent people from coming to Blacksburg. But they can't tailgate, or there'll be repercussions. So it's a tough one. Mike, do you want to say a little bit about what you have been involved with? You've been in some of those discussions.
Sure. I meet every week with the athletics team as they work through what football or what any sport's going to look like in the fall. So per the governor's order, the maximum crowd capacity for a football game is 1,000 people. that pretty much is, those numbers are pretty much met by the families of the players and the coaches. And so as of today, there will be no ticket sales for games. Again, a crowd will be less than 1,000, no more than 1,000. There is no tailgating on campus. So there's really no reason to come to campus for a football game presently. The governor's decision not to do something different for football, whether it's here or UVA or even the race that's occurring in Richmond, I think this weekend, I think shows commitment to make sure that we don't do that. So we don't bring essentially a different population into, what is a larger pod that is, is the Blacksburg community.
Frank, did you want to add anything?
Well, I was just trying to remember if UVA still played football.
No, yes, apparently. So, yeah, I think one of the points you raised, Adil, though, is that it's a really good one. We, even without tailgating, at least not permitting it and enforcing that on both the campus and in the town, we know that people are going to gather. And what I would just ask people to do, if that game is played, and I certainly hope it will be, let's make sure that we commit to celebrating or engaging with our pod only and or our family group, whatever that may be, and not getting larger groups together. And this is where I think we could probably come up with some social media help or electronic assist here in terms of gathering people, maybe pod to pod, and connecting them via some other mechanism virtually, because it's hard. I mean, it's a big game, it's a lot of fun, but we just can't do what we normally do. We're not going to be able to do it. And I support the governor's move. I originally questioned it because the reality is outdoors in a 65,000 seat stadium, you could get more people in there and I think be safe for the event itself. But as Mike Mulhare mentioned, the issue is not the event, it's bringing people from outside the community into the community.
President Sands, I'd like to go back to something that we started off very early about. Did you say that we submitted a plan to CHEV, or I forgot the exact governing body that we submitted plans to, regards to what our contingency plans are for Virginia Tech moving forward, at least for the rest of the semester? Is that public, and could Virginia Tech tweet that out specifically to that document or whatever it is?
Yeah, it's on the VT Ready site, so you can find it there. It's also one really easy way to get to it is to type in CHEV, SCHEV, and COVID. I think that will probably get you to the plans for all of our public institutions in Virginia, actually all the institutions in Virginia. And you can click on the Virginia Tech one on the CHEV website, but it is on the VT Ready site as well.
Okay, and I have to say this statement, just to calm nerves of the entirety of the student body. There's a lot of rumors going around saying that Virginia Tech is going to close after the tuition deadline refund date has passed. Is it possible for you to ensure that's not the master plan of the university?
Thank you, Murray, for mentioning that. I've heard that rumor many times. No, absolutely. The reason we're here together in Blacksburg and around the Commonwealth in different forms in our other sites is that Virginia Tech as an entity is not an online, especially at the undergraduate level, not an online adult learner enterprise. It is a community of scholars. It's a community of young people, especially for the Blacksburg campus and our undergraduate population on the whole. We have a very diverse group of students as well, but for the most part, we are set up to be in community as learners. And that applies to our discovery mission, and it certainly applies to our engagement mission and extension and everything we do in the communities. So we have been so insistent on having an in-person component, not because we want to gather people's tuition dollars or room and board dollars or whatever it may be. It's really about doing what we do. If I thought that we could be done with this in the fall, if someone came to me and said on November X date, there's going to be a vaccine and everybody's going to get it and it's going to be 100% effective. To be perfectly honest, we would have a different approach. But the assumption that we're making is that we're going to be doing this for at least a year. And we hope it's not the case, but we believe that's the case. And that we just have to get about doing our business. So we're not on the, we're going to do the best we can to mitigate the effects of COVID-19. I won't hold out I won't say categorically that we won't change direction, but to be perfectly honest, I think what we're learning is that going remote wouldn't help that much. It might make a little difference, but probably not enough to justify the hassle of it. And depopulating residence halls, for example, we already know that that's not a good idea. And so in terms of, if you look at it holistically and what you could do to spread the disease outside of the community. So my commitment, and I said this to our leadership team, is once we're in, we're committed. And of course, if something unforeseeable happens, yeah, we'll have to look at that again. But again, going remote or doing it for tuition dollars, to me, doesn't make any sense. So yes, we're not planning to do anything associated with any kinds of deadlines associated with tuition. Matter of fact, we have conversation. We want this to be a community of the willing. And we've tried to establish that with the faculty over the summer because we've been able to work with them and be in a position where the instructors, whether it be faculty or graduate students, are able to engage in the way that they feel comfortable with. Most of whom would love to be in person, but only a small fraction feel that it's the appropriate way to go given that COVID-19. And we'd like our students to feel the same way too. And so if there's any adjustments we make going forward this semester, I think it's going to be in looking for ways for people to be able to exercise their choices and we not throw up additional barriers, financial barriers that would prevent people from doing what they feel comfortable doing. So we want it to be a community of the willing. We do not want to make people feel like they're trapped in Blacksburg or in Roanoke or in the National Capital Region. So let's continue the dialogue and let us know where, and I really do appreciate everything I've heard today in terms of understanding what those barriers might be and what we should be thinking about in order to make sure that it is a community of the willing.
And President Sands, one final question, and I promise I'll be done, and I think all of us will be done. I think a lot of this was informative. Is it possible for you to commit to doing more of these, not only on COVID, but other concerns to the student body?
Yes, I think this was a trial run. As I mentioned earlier, our former way of doing things was helpful in the sense that we were able to communicate outward. We were collecting questions and then consolidating them. I'd rather have all of you and others asking the questions directly, even though we can't open it up wide open because of security concerns. I think that the more dynamic and spontaneous it can be, the better. And we certainly learn a lot from it. So I'd like to thank everyone on the panel, our students and our administrative support, faculty members who participate in these, and we'll continue to do this model going forward.
Thank you again.
Dr. Sands, can I make two last comments before we go off? Just one's a slight correction. If you're off campus and you want to inform the university that you may be positive, please don't call Schifrit, call the Dean of Students office.
Oh, thank you.
That's the place to call. And the second is not really COVID related. It's a concern I had with a statement that was made, and I may not have got this right. It says, but it was said, do not want to call the police department because of risk of bodily harm or being killed. I've been here at Tech for a long time. My son and daughter were at Tech. They're both here on April 16th. That is so far removed from reality, but I'm very concerned if that's perception. And if that's perception, then I'd like to get a dialogue started with the appropriate individuals so if we can bring that back to some sort of sense of normalcy. That statement concerns me greatly. And again, I welcome to start that conversation with the appropriate individuals here and also with our police department.
Thank you, Mike. Thank you, President Sands. I just wanted to thank all of our administrators for answering questions and of course to each of our students for being part of this conversation today. Thank you to everyone watching. Remember, you can find the latest information on the Ready website. There's a lot of information there, a lot of what we talked about today in more detail. And of course, we will keep you posted on the continuing webinars, just like this one, that we will continue to do moving forward. So thank you all for watching.
Thank you.